That's a really good question, and I can see why that's a really important thing to cover. What I would say is, a series of focus groups, right? Or just town halls, right? If you could bring like a round table with about 6 or 8 patients together, perhaps a oncologist, and then a psychologist, right? And also a therapist, and have an open conversation and dialogue, because what's going to happen from that interaction is a number of opportunities are going to unfold in terms of topics that you really need to cover and educate people on, because there's probably some myths that are out there that may be preventing people from taking some really important steps. And until we start having an open conversation, an open dialogue and listening, we're really not going to know. And so I think we've got to pull people together. And for BDO, I mean, that's something that we could do. We could pull those people together and start having those conversations. That's interesting. There is an organization that I ran into, the National Association of Black Oncologists, right? And so it could start there, but I think more importantly, from a logistics perspective, just culturally sensitive doctors, right? I think we've got to start educating doctors, oncologists on, and the thing about it is, even though 89% of patient population is white, the 7% of the remaining percentage are black patients. And what I learned from physicians is that, they want to provide good service even if 1% of their patients are black, right? And so if we can deal with this cultural sensitivity piece, bringing doctors to the table, understanding that, the way you interpret something, the way you ask a question, if you ask a question the way you normally ask it, you may not get the answer that you think you should get. For example, the average patient is 70, right? And a 70-year-old, 75-year-old going to the doctor, right? If you want to endear yourself to the black patient, let me start with me. If I go to the doctor, hey, call me Reggie, right? You call me Reggie, that's a term of endearment for me because everybody calls me Reggie. But if my dad goes to that same doctor, right, the term of endearment for him is Mr. Ware, because back then, adults weren't really given respect. And when you say Mr. Ware, that's a term of endearment. So understanding how to get people to relax and put their, relax, open up, and really start having the conversations is critically important. So things like that, I think, are the things we could do and should do. Access is a big issue. It continues to be a challenge. And there's a wealth divide, right? There's a wealth divide between blacks and whites and so forth. And so I think we have to, one of the things we could do is the programs that do exist, right, that can help, we have to increase the awareness of those programs, because sometimes people neglect the treatment because they think they can't afford it. Sometimes doctors don't recommend the best treatment because they do the math and say these people can't afford it. But if we can increase the awareness overall with physicians and patients in terms of opportunities, right, and programs that could help and assist with the financing, I think that makes everything a little bit better. I think that's where BDO, blackdoctor.org, we call ourselves BDO, but I think that's where we can play a really important role, because, as the trusted intermediary, if you will, to these important outlets, we need to say, sometimes people need to hear that, hey, these people are okay, this is a great program. And so if you take the resource groups, right, and you make those, and you have them talking about it, and you take trusted intermediary platforms like BDO, and we start talking about it, it's all about awareness, right? If we can get people aware of something, then that's going to trigger something. Okay, well, that's interesting, and then we can drive them to action. But we can't drive to action without increasing the awareness piece. And so there's opportunities all around, and there's a lot of work that we need to do, and I think we're all ready to do it. We just got to start today.